Hello dear students, we are going to discuss today on the concept and uses of drug interaction information. Drug interaction information mainly contains food and drug interaction, nicotine and drug interaction, alcohol and drug interaction, and other patient variables like legal aspects of drug interaction legislation. Now we will discuss about food and drug interaction. Drug interaction is change in the effect of one drug by the presence of another drug, or herbal medicine, food, drink, or by some environmentally present chemicals. Now interaction between drugs and foods, beverages, dietary supplements are called drug-food interaction. Caffeine, nicotine and alcohol can also be responsible for drug interaction. Diet and lifestyle can sometimes have a significant impact on drug response. Physicians and pharmacists have recognized few foods that when taken with simultaneously with some drugs can alter the body's ability to utilize a particular food or drug and can cause serious side effect. Now, clinically significant drug-food interaction which poses potential harm to the patient may result from changes in pharmacokinetic or pharmacodynamic properties of a drug. Major side effects of some food on drugs are caused due to clinically important alteration in the drug absorption through changes in GIT motility or by fatty, high protein and high fiber containing diet. The most important drug-food interaction that are associated with high risk of treatment failure arising from significantly reduced bioavailability of the drugs. Such interaction are frequently caused by chelation of drug with components of the food. Now, bioavailability is an important pharmacokinetic parameter which is correlated with the clinical effect of most of the drugs. Now, gastric acid secretion as a physiological response to food intake in particular may reduce or increase the bioavailability of certain drugs. Some foods can alter metabolism characteristic of drugs like grapefruit juice, which is the most well known example, like ceviolin, orange, star fruit and certain agents that inhibit cytochrome P450 enzyme in the liver is the most important enzyme for drug metabolism. Several fruits and berries have recently been shown to contain agents that affect drug metabolizing enzymes. Now, in contrast to the easy access to information on drug interaction, information about food drug interaction is not always available conveniently. Now, it is difficult and complex problem to accurately determine the effect of food or nutrients on a particular drug. Some significant food drug interaction. Now, we will give some example of important drug food interaction with their consequences like cruciferous vegetable and charboiled meat. Brussels sprout, cabbage and broccoli like cruciferous vegetable contain substances that are inducer of cytochrome P450 isoenzyme like CYP1A2 that interact with charboiled meat. Carcinogenic heterocyclic amines are created by high temperature cooking of meat. Now, high temperature cooking, particularly charring of meat, forms some cancer causing heterocyclic amines. Now, charboiled meat induces CYP1A2 due to their high concentration of oleocyclic aromatic hydrocarbons. Now, another example is fruit juice. Grapefruit juice, among all the fruit juices, this poses high interaction chances with the drugs. Now, in scientific study explored that effect of alcohol on phenoldiphine grapefruit juice was chosen to mask the taste of alcohol, which led to the discovery that grapefruit juice itself markedly increases phenolphthalein blood level. Now, grapefruit juice contains a class of component called furanocoumarins that can cause the body to metabolize drugs abnormally, resulting in lower or higher than normal blood level of the drug. The flavonoids like camphorol, naringin present in grapefruit juice are identified as esterase inhibitor that mediate pharmacokinetic drug interaction with most of the calcium channel blockers and cholesterol lowering statins such as enalapril, lovastatin, possibly resulting in excessively high blood level of the drugs. Now, along with an increased risk of serious side effect, grapefruit juice inhibits intestinal CYP3A4 also and slightly affect the hepatic CYP3A4, increasing oral bioavailability of medications that are CYP3A4 substrate. Now, naringin present in grapefruit degrades to naringenin during the processing, which is known to inhibit the CYP3A4. Now, other possible active constituents in the whole fruit including bergamottin and dihydroxy bergamottin, some drugs such as fexofenadine that are not metabolized by CYP3A4 but still show decreased level with grapefruit juice. Now, furanocoumarins and active bioflavonoids present in grapefruit juice are also inhibitors of organic anion transporting polypeptide, shortly we call OATP, and when ingested concomitantly then reduces the oral viability of OATP substrate like fexofenadine. Now, compounds present in grapefruit juice are able to inhibit P-glycoprotein modifiers and deposition of drug that are P-glycoprotein substrate. Another important fruit juice having potential chances of drug-food interaction is cranberry juice. The combination of warfarin with the cranberry juice ingestion appear to be associated with an elevated internationally normalized ratio. Now, internationally normalized ratio is how long it takes blood to form a clot, now without the bleeding. Now, cranberry juice contains flavonoid which can act as inducer, inhibitor or substrate for the biosynthesis of several cytochrome P450 isoenzyme. Specifically, cranberry juice may inhibit the activity of CYP2C9, the primary isoenzyme involved in the metabolism of S-warfarin isomer. Now, we will discuss about the orange juice. The intestinal absorption of celiprolol, which is a beta blocker, is inhibited when it is taken with orange juice. Hesperidin present in the orange juice is responsible for the decreased absorption of celiprolol. Warfarin and green leafy vegetables. Warfarin is an anticoagulant that prevents blood clotting. Some vegetables are high in content of vitamin K. Eating large quantity of foods rich in vitamin K can interfere with the effectiveness and safety of warfarin therapy. The highest concentration of vitamin K are found in green leafy vegetables such as kale, collards, spinach, turnip greens, parsley, Brussels sprout, broccoli, asparagus, etc. There is a possible interaction between warfarin and high protein diet also, as high dietary protein intake raise serum albumin level and or cytochrome P450 activity, resulting in decreased internationally normalized ratio. Now, discuss about monoamino oxidase and tyramine containing food. It is well known that tyramine present in some foodstuff may reach in toxic concentration in some patient taking monoamino oxidase inhibitors. We call mouse. The first generation mouse such as phenelgin, isocarbazide were largely non-selective inhibitors of both substrate of MAO-A and MAO-B. Tyramine is an indirectly acting sympathomimetic agent degraded by MAO, but in the presence of MAO inhibitors, it escapes degradation and reaches the systemic circulation, where it is taken up by the adrenergic neurons, leading to a hypertensive crisis, also called cheese reaction. Tyramine rich food like matured cheese, red wine, ripe bananas, yogurt, shrimp paste, salami interact with MAO inhibitors causing hypertensive crisis or severe and dangerous elevation in the blood pressure, also called cheese reaction. Antitubercular drugs like isoniazid have been associated with the tyramine and histamine interaction. Inhibition of MAO and histaminase by isoniazid can cause significant drug-food interaction. Now, another interaction is markaptopurine with xanthine oxidase containing food. Now, markaptopurine is a purine analog used for acute lymphoblastic anemia and chronic myelogenic leukemias. Markaptopurine is inactivated by xanthine oxidase, and concurrent intake of substrate containing xanthine oxidase may potentially reduce bioavailability of markaptopurine. Cow's milk is known to contain a high level of xanthine oxidase. Now, antibiotics and milk products. Food intake can influence the effectiveness of the antibiotic, this is well known. Now, dietary products such as milk, yogurt, cheese can delay or prevent the absorption of antibiotics such as tetracycline and ciprofloxacin. Now, co-administration of antibiotics with milk products rich in divalent calcium and magnesium ions form insoluble chelates with some antibiotics and prevent their absorption. The intake of dietary products, however, needs to be monitored and encouraged with appropriate consideration of specific antibiotic involved. Even a little quantity of milk containing like tea or coffee can extremely small amount of calcium can severely impair the absorption of tetracycline. Now, very important interaction of cardiac glycoside and dietary protein, which is less well known but very important. Digoxin is used to strengthen the concentration of heart muscle, or slow the heart rate and promote the elimination of fluid from body tissues. Dietary fibers, especially the insoluble fibers such as wheat bran, can slow down the absorption of digoxin and lessen its effectiveness. Cardioaptic drugs can also interact with licorice, glycyrrhizin, glycyrrhizinic acid, a common ingredient of dietary supplement containing licorice extract, which is a potent inhibitor of 11-beta hydroxysteroid dehydrogenase. They increases cortisol level that act on mineralocorticoid receptors, causing sodium retention and potassium depletion, thus interfering with various medicine including antihypertensive and antiarrhythmic agents. A high intake of licorice can cause hypermineralocorticoidism with sodium retention and potassium loss, edema, increased blood pressure and depression of the renin-angiotensin-aldosterone system. Digoxin taken with glycyrrhizin can cause irregular heartbeat and heart attack. Now, we will discuss about interaction of angiotensin converting enzyme inhibitors and potassium containing food. Angiotensin converting enzyme inhibitors or ACEs along with or in combination with other drugs are used to lower blood pressure or to treat the heart failure. ACE inhibitors can increase the amount of potassium in blood. High potassium level can cause an irregular heartbeat and heart palpitation. Foods with high potassium content like banana, orange, green leafy vegetables and salt substrate. Patients on antihypertensive drug therapy get benefited from concomitant moderation of sodium restricted diet. Now, potassium sparing diuretics interaction with potassium containing food. Diuretics remove water, sodium, chloride from the body, reducing swelling and excess fluid caused by heart or liver disease and also normalizes the high blood pressure. Hydrochlorothiazide light diuretics causes loss of the minerals like potassium, calcium and magnesium from the body. Now, potassium sparing diuretic like triamterene decreases the kidney ability to remove the potassium, which can cause high level of potassium in the blood called hyperkalemia. High potassium is harmful and can cause irregular and rapid heartbeat. While using diuretics that can increase the potassium, eating large amount of food containing high potassium should be avoided. Interaction of oral bronchodilators and caffeine containing drink. Both oral bronchodilators and caffeine stimulate the central nervous system. Using bronchodilators with food and drink that have caffeine can increase the chances of side effects such as excitability, nervousness and rapid heartbeat. While on thiopylline therapy, which is a xanthine derivative, consuming large amount of caffeine containing food like chocolate, cola, coffee or tea that contain the xanthine can increase the risk of drug toxicity. The effect of presence or absence of food in GIT. This is also a very important factor for drug-food interaction or drug-drug interaction. Some drugs work faster or slower, better or worse when taken on a full or empty stomach. On the contrary, some drugs irritate or even damage the stomach if taken in empty stomach, and presence of food helps to reduce this effect. Food-drug interaction may reduce the bioavailability of drugs taken after meal, which is called negative food effect. The example is bisphosphonate prevent osteoporosis, a condition in which the bone becomes thin and weak and breaks very easily, by preventing the bone breakdown and increasing the bone thickness. Alendronate or resindronate work only when taken on an empty stomach. Administration with even a mineral water can interfere with bisphosphonate. Food, drink, dietary supplement, calcium, vitamin, antacids or any other medicine should not be taken at least 30 minutes after taking the bisphosphonates. Now, azithromycin absorption is decreased when taken with food, resulting in a nearly 43% reduction in bioavailability. Tetracycline should be taken 1 hour before or 2 hours after meal and should not be taken along with milk. Propranolol serum level may be increased if taken with rich protein food. The absorption of AC inhibitors is increased when taken in the empty stomach. Food slows down the absorption of acetaminophen in stomach. Co-administration of acetaminophen with protein delays its absorption and onset of action. Concomitant administration of statin with food may alter statin pharmacokinetic or pharmacodynamic, increasing the risk of adverse reaction such as myopathy or reducing their pharmacological action. High fiber diet may lower the efficacy of statin like simvastatin, ezetimibe, pravastatin, fluvastatin. The absorption of rosuvastatin, another anti-hyperlipidemic agent, was significantly decreased in the fat state compared with the fasting state. We suggest that rosuvastatin should be administered on an empty stomach. Now, consumption of pectin or oat bran together with lovastatin reduces absorption of the drug. High fat meal may increase the amount of bronchodilator theophylline in the body, while high carbohydrate meal may decrease it. Food greatly decreases isoniazide bioavailability. Olenoic acid, a triterpenoid, exists widely in food and medicinal herbs, has antimycobacterial activity. Thus, when administered with isoniazide, it exerts synergistic effect. High fat meal decreases the serum concentration of cycloserine, a bacteriostatic antitubercular drug, and results in incomplete eradication of bacteria. Concomitant intake of food with antihistaminic exhibits significant increase in bioavailability. These are the example of the negative food effect. Now we will discuss some positive food effect. Glimepiride is an anti-diabetic and a new generation sulfonylurea derivative, should be administered with breakfast or with first main meal of the day. The maximum effectiveness of acarbose and alpha glucosidase inhibitor is attained when the drug is taken immediately at the start of such meal, because it delays the carbohydrate absorption by inhibiting the enzyme alpha glucosidase. The example like NSAIDs like ibuprofen, naproxen, ketoprofen and others can cause stomach irritation. Thus, they should be taken always with food or milk. Now, cholesterol lowering agent lovastatin should be taken with food to enhance the gastrointestinal absorption and bioavailability. Now, nicotine and drug interaction. Nicotine, which is a major constituent of tobacco. Tobacco smoke contains many different compounds that have enzyme inducing property, which may affect the dose requirement of neuromuscular blockers. In addition, the time interval and referring from smoking will affect plasma nicotine concentration. Small doses of nicotine may stimulate the neuromuscular junction, but larger doses may block the transmission. Tobacco smoke contains compounds that increases the activity of the liver enzyme concerned with the metabolism of dextropropoxifen, pentagocin and other opioids, which increases the metabolism, decreases their blood level and diminishes their effectiveness as analgesic. Smoking might have an effect on pain perception and or opioid response, or that nicotine addiction and opioid requirement may be genetically linked. Smoking and use of nicotine patches may increase the insulin resistance. Diabetic persons who smoke tobacco may need more subcutaneous insulin than non-smokers. The effect of smoking on diabetes appear to be complex. Preliminary evidence shows that smoking increases the absorption of insulin. Smoking tobacco increases heart rate, blood pressure and the severity of myocardial ischemia, probably as a direct effect of the nicotine and due to the reduced oxygen carrying capacity of the blood. These actions oppose and may be even totally abolish the beneficial action of the beta blockers. Smoking stimulates the liver enzyme concerned with the metabolism of some beta blockers like propranolol, so that the serum level are reduced. Caffeine causes the release of catecholamines such as adrenaline, which could account for the increase in the heart rate and blood pressure. Now we will discuss about interaction potential of alcohol with drug. Pharmacologically, alcohol mode of action is CNS is much in common with the drugs that depress the central nervous system. Alcohol can interact with many drugs both by pharmacokinetic and pharmacodynamic mechanism. The quality, the quantity, frequency of alcohol consumption affects the bioavailability of alcohol in other drugs. Several hepatic enzymes are important in the metabolism of alcohol. Primarily, alcohol dehydrogenase convert alcohol into acetaldehyde, but enzymes like cytochrome P450 isoenzyme CYP2E1 are also involved in the metabolism of alcohol, especially in moderate to heavy alcohol consumption. Enzyme induction of CYP2E1 occurs after prolonged or heavy alcohol intake, and this can result in an increased metabolic rate and lower blood level of drugs metabolized via this system. Conversely, short-term binge drinking is likely to cause inhibition of this enzyme group by direct competition for binding sites and therefore decreases the metabolism of other drugs. The most common drug interaction of alcohol occurs with CNS depressants, resulting in even further CNS depression. This can also occur with some antihistaminics, antidepressants, anxiolytics, sedative and hypnotics, opioid analgesics and others. The less common interaction that can occur between alcohol and some drugs is flushing reaction or called Antabe's reaction. This is exploited in case of disulfiram treatment, which is used as a drink deferent agent, but it can also occur unexpectedly with some drugs such as some antifungals, cyclosporin, chlorpropamide and metronidazole. Taking alcohol along with metronidazole and griseofulvin can cause nausea, stomach cramp, vomiting, flushing and headache, making heart to beat faster. Now, chronic alcohol use can increase the risk of liver damage or stomach bleeding, and along with some drugs this can be dangerous. Some important drug alcohol interaction we will discuss now. Interaction with anti-diabetic agents. An alcoholic drink can increase or prolong the effect of insulin or other oral anti-diabetic agent and thus lead to hypoglycemia or low blood sugar. The glucose lowering action of alcohol can last as long as 8 to 12 hours. Now, interaction of alcohol with bronchodilators. Bronchodilators are used in bronchial asthma, chronic bronchitis, emphysema and chronic obstructive pulmonary disease. Alcohol taken with theophylline can increase the risk of side effects such as nausea, vomiting, headache and irritability. Now, another potential drug that interact with alcohol are NSAIDs, non-steroidal analgesic and anti-inflammatory drugs. Acetaminophen and some other analgesic can cause liver damage. The chances for severe liver damage is higher if alcohol is consumed concurrently on a regular basis. Now, antihistaminics, like some antihistaminics can cause drowsiness, and use of alcohol should be avoided as it can add it to the drowsiness causing effect of antihistaminics. Narcotics, alcohol can increase the chances of dangerous side effect like coma or death caused by the narcotic analgesics. Now, with statins, statins lower cholesterol level by decreasing the rate of production of low density lipoprotein along with the triglycerides. Use of alcohol should be avoided as it can increase the chances of liver damage. Now, interaction of nitrates with the alcohol. Nitrates prevent angina by relaxing the blood vessels and improving the blood and oxygen flow to the heart. Alcohol may add to the blood vessel relaxing effect of nitrates and lead to a dangerously low blood pressure. Chronic alcohol consumption while on isoniazid therapy may have an increased risk of developing isoniazid induced hepatitis. Many alcoholic drinks contain tyramine, including tap beer, red wine, sherry and other liqueurs. Tyramine can also be present in alcohol free and reduced alcohol beer that can cause hypertensive crisis as occurs in cheese reaction. Now, we will discuss about the patient variables responsible for drug interaction. Now, drug interaction is a pharmacological response which cannot be explained by the action of a single drug, but occurs due to two or more drugs acting simultaneously. The effects of a drug may be changed by another drug, presence of food, drink or by some environmental chemical agent. The clinical relevance of drug interaction is evident when one considered that up to 8% of hospital admissions are due to adverse drug reaction and over 20% of these cases are due to drug interaction. Drug interaction can vary from person to person because of changes in the absorption, distribution, metabolism and excretion of the drug within the body. There are some common patient related variables that can increase the risk of drug interaction. These are genetics, age, sex, body weight, diet, exercise, other underlying diseases, current undergoing medication and addiction behavior of the patient. Self-medication and irrational use of other over-the-counter medicines that can cause the drug interaction. Patients sometimes contribute to the problem by self-medicating themselves, failing to follow the prescribing direction, failing to report all the medications or OTC products used simultaneously and borrowing or trading medication with other patients. Now, we will discuss about the age factor. The patient characteristic which has the most bearing on drug interaction is age. Old age patients are likely to have many health problems and thus take several prescriptions and over the counter drugs. Liver metabolism, kidney function, nerve transmission and functioning of the bone marrow decreases with the age. Renal or hepatic impairment like age related issues also affect the ability to metabolize a particular drug. Likewise, infants and very young children are also at high risk of drug interaction as their capacity to metabolize a drug is not fully developed or evaluated. Neonates have immature renal tubular function, physiologic hypoalbuminemia, low body fat, immature blood-brain barrier and poor cardiac compliance due to immature baroreceptors. Now, disease co-occurrence factor. Patients with severe underlying disease are less tolerant to changes in plasma concentration of any drug therapy. Plasma concentration of drugs that are metabolized in the liver and or eliminated by the kidneys may be altered if either of these organs is not functioning correctly. Disease related to liver and kidney alters the enzyme system and excretion characteristic affecting the pharmacokinetic of drugs. Diabetes, high or low blood pressure, ulcer, glaucoma, enlarged prostate, poor bladder control and insomnia are particularly important because patients with such diseases are more likely to have drug disease interaction. Now, factors like genetic variation in patients. Genetic characteristics relating to the approximately 10% of the population may affect some drug interaction like interaction with grapefruit juice. Genes are responsible for synthesis of enzymes and metabolizing drugs, and genotypic variation can cause decrease or increase in the activity of some enzymes. The factor polypharmacy. What is polypharmacy? Polypharmacy implies to the prescription of too many medications for an individual patient with an associated higher risk of adverse drug reaction and interaction. Polypharmacy is a problem of substantial importance in terms of both direct medication cost and indirect medication cost resulting from drug related morbidity. Polypharmacy increases the risk of side effect and interaction in certain patient groups, for example in elderly. Particularly dangerous reaction that can occur when a patient takes 2 or more drugs. It is estimated that for patient taking 2 to 5 drugs daily, the incidence of potential drug interaction chances are more than 19%. This rises to about 80% for those taking 6 or more drugs. Now we will discuss about sex difference on the interaction capabilities of drug. The biological difference of male and female affects the action of many drugs. The anatomical and physiological difference mainly occurs in body weight, body composition, gastrointestinal tract factors, liver metabolism and renal function. Women in comparison to men have lower body weight and organ size, more body fat, different gastric motility and lower glomerular filtration rate, affecting the pharmacokinetic and pharmacodynamic of the drugs, including drug absorption, distribution, metabolism and elimination. Gender differences also have implication on social behavior and cultural differences as well. Female specific issues such as pregnancy, menopause, menstruation may have profound drug effect on the humans. Now we will discuss about effect of diet, body weight and exercise. The food component of diet can potentially interact with certain drugs like cheese and red wine containing tyramine rich food interacts with monoamine oxidase inhibitors causing severe hypertension. Calcium rich milk decreases GIT absorption of tetracycline. High fat meal interferes the absorption of some drugs. Distribution of a given drug may also vary from person to person, like obese person may store large amount of fat soluble drugs, whereas very thin people may store relatively little. Now what are the effect of addiction on drug interaction? Smoking, consumption of alcohol and use of dependence producing drugs leads to increased chances of drug interaction. Alcohol affects the metabolism of many drugs, functionality of the liver causing liver cirrhosis and liver hepatitis, which in turn affect the ability of the organ to metabolize the drugs. Alcohol drug interaction may be more harmful when elderly patients mix them with together, as age and alcohol lead to many health problems. Smoking is one of the risk factors of many diseases like peptic ulcer, cancer, cardiovascular diseases. Smoking also affects the metabolic process by affecting the liver enzyme, acting on a potent inducer of the hepatic cytochrome P450. Now we will discuss about the legal aspect of drug interaction legislation. Drug injury legal compensation cases mainly involve personal injury or wrongful death claims filed on behalf of patient who unfortunately experienced a serious side effect or had an adverse reaction or died from the uses of a prescription medicine. Medical practitioners and pharmacists are obliged to keep abreast of information related to dangerously drug interaction. This poses significant challenges for health practitioners. Continuous review of medical journals for reports of drug and drug interaction is one way to update knowledge that eventually shapes the standard of care. Recent technological advances such as computerized drug to drug interaction software packages are gaining increasing recognition as a means of reducing medication error. The law has also established standards of conduct that promote the incorporation of such information into therapeutic decisions. The pharmacist has the responsibility to protect the patient from adverse reaction of medication, including any medication taken by the patient such as OTC medicines or any chronic medication received from other suppliers. Hope you all enjoyed this information we have given in this lecture. Thanks a lot and goodbye.